Hi, good afternoon. My name is Deborah. I am a certified professional midwife. I am a licensed midwife in New Jersey and in Florida. I am a certified lactation counselor, and I am currently the owner and operator of Counterculture Midwifery, which is a midwifery practice that serves PA community, specifically Lehigh Valley, Stroudsburg, Scranton, and the surrounding areas. I provide home birth for families in the area, and am super happy and excited to be here. A little bit about myself. I went through nursing school, and then after nursing school, I worked with the Florida Department of Health, the WIC program, which is Women, Infant, and Children Supplemental Nutrition Program. And what I did is I worked with breastfeeding women, and I helped the community with their breastfeeding needs. Most of the women that came in had hospital experiences. There were a few that chose out of hospital birth. We did have 2 local birth centers in the community at that time. And so I got my opportunity to work with a large group of women that chose either to breastfeed or supplement or both. After my last child, I started looking for programs where I could work as a midwife, like actually go to school, start the journey to going to school as a midwife. And I worked as a birth assistant at a birth center and then went to midwifery school. I am really pleased as of today, actually. I am 3 years graduated. 3 years ago today, I walked across that stage and finished midwifery school. So after midwifery school, I served my community as a home birth midwife, and then we moved up here in August of 2017, and we started the process of my husband going to school. So now I get to serve the communities in Pennsylvania, which has been a really lovely experience thus far. And the reason I am videoing today is that I have a wonderful book that I feel would be very helpful to a lot of mommies in the community. And this really doesn't matter, Pennsylvania, New Jersey, New York, Florida, California, wherever you're from. This book I feel would be very helpful to have in your library as a mother. This book I was introduced to by a midwife in Florida that I worked with, and a lot of what our care is as midwives is encouraging the family to seek out education and to also learn about their options as far as pediatricians are concerned. I do encourage my mommies when they are having their babies to seek out a pediatrician that encourages their wishes and desires for their child just as much as I do in my care, and encourage them to make their choices. Informed decision making is super important, especially as a mother, and I have 4 children of my own that are in-house currently, and it's important to me as a mother to make those decisions to take care of my children, and it's also good for my self-esteem and to feel like I'm making the best choice I can in their childhood. So this book has been really wonderful. And the name of the book, right, you guys are probably all wondering, sitting here for the last minute going, what is it? Is Take Charge of Your Child's Health by Dr. Wu Tan. It's a wonderful, wonderful book that discusses a lot of different things. I'm going to do the first introduction and the foreword today, and then I'm going to have future videos on each chapter because it is broken down into parts of the body, but not just parts of the body. It talks about childhood disease, it talks about marriage and family, it talks about communication and discipline, a lot of different aspects. So this is a holistic book. This is not a book that says your kid has a fever, we're going to treat your child one way. We're going to look at all aspects of why illness may be present in the family. We're going to look at all aspects of healing. And that doesn't just start with a symptom. It starts with what is your child consuming in their diet? What kind of environment is your child in? And then you as a mother or a parent, a guardian, in your family, what does your family life look like? Because all of those things not only affect our children, but they affect us and how we parent and what choices we make. So with all of that introduction, I want to start off with one of the things that he mentions in his book in the foreword. I want to read it. It's the first paragraph. It's pretty fantastic to open a book and hear this. So, it's no secret. Recent studies confirm that most doctors have little time to talk with us during office visits and even less time for listening. As a pediatrician said to me recently, with 6 kids with fevers sitting in the waiting room, I just don't have time to give mothers the information they need about breastfeeding. Thank goodness we have Lele J. to take care of that. It's true. If you look at the statistics tell us doctors, and I will tell you OBGYNs are in the same grouping, is that they have 6 minutes face-to-face with each patient. The nurse comes in, they do all the vital signs, then the doctor comes in and tries to treat in 6 minutes based off the symptoms the mother gives him. And then a little bit later on, he talks about, in the author's note, each body is unique and we are alike in some ways. These similarities are what allows us in the medical profession to develop a standard treatment. Many particular bias, however, is toward discovering those individuals different that cause some of us to not follow the normal path. So we have this 6-minute face-to-face, and then because we only have 6 minutes, we take each symptom and we develop what's called a standard of care or a standard treatment. And so what that means is that when you come into the office and say you have a child that comes in, runny nose, sore throat, feels pretty horrible, the method of treatment then, after the vital signs, as long as those are all normal, is to say, okay, well, this is what I suspect is happening based off the mother's symptoms that she describes the child having. Let's do this particular test and this particular test, and we are either going to rule out or confirm what the doctor thinks the diagnosis is. So, for that particular example, they may run a strep test. They may choose to do an RSV test. RSV is a respiratory virus. They may do a bacterial swabbing, strep throat. They'll swab the throat. And then if any of those things come back negative or positive, then they'll base their treatment off of that. So if it comes back for strep throat, then normally the standard of care is to prescribe antibiotics. If it's a viral, usually that means that they get to go home and they get to fight it off without the use of antibiotics. Some doctors choose to still use the standard of care of sending home an antibiotic just in case. So we have a lot of doctors that sometimes send children home with an antibiotic. Now they'll go home, they'll rest, they'll take an antibiotic, they'll hopefully get well, and they'll go home. And based off 6 minutes, and based off the symptoms mom states, is antibiotics always 100% what our children need to be taking? I question that. Even for strep throat, I know strep throat is a controversial subject, and that is the standard of care. Now, in any way, shape, or form, am I saying don't go to the pediatrician? Absolutely not. Pediatricians are wonderful. They have their place. I'm glad we have them in the community. They are trained specifically to catch childhood illness, and that's important. And so you need to have a pediatrician. You should have a backup. You should have the ability to call and make an appointment if your child needs evaluation. You should have the ability to do a well child visit once a year. But rooting out, like when the necessary need is to go and when to go, I think are things that we really need to have conversation about. I have seen, and this is not to like bash on any of the Facebook groups at all, but I have seen where a lot of our moms are going to Facebook, they're going to different social media to ask those questions and say, my child has this. Should I be calling the doctor and getting to the pediatrician? Taking pictures like, here's a rash, what should I do? And I feel that at one point in time in our history as human beings, we had a village mentality. We had the ability to go to mother right down the street or go to the mother in the next hut, or we had a healer in our community that people had access to where they could ask these questions. And they would be able, most of the time, to get good information. I think with the internet and the doors opening with the internet, we get a lot of misinformation. We get a lot of poor information. I feel a lot of it's also fear-based. That if you don't go, your kid's going to have this and this and this, and it's going to be a horrible experience. And not everybody's experience is the same thing. And so in some aspects, Facebook is good because you have this reassurance from other moms who have experienced, 101 fever is nothing, let them burn it off. In some aspects, we have people who have experienced things that are negative and can, quite frankly, scare a mother, and maybe misinformation. Breastfeeding, the number one thing I can probably cite out there, how much good information is there and how much bad information, and how many women really know the truth, like, this is what I should do. And let me ask you this, how confident are you as a mother? I think that in our community, we have had a lot of mothers feel like their confidence is been either degraded or not present. And some of this in of itself is because we have a community that's not supporting our moms. If you walked into a pediatrician and you have a newborn and the mother knows that this baby is going to lose 10% of its weight, right? When the doctor says, the baby's lost like a half a pound, that wouldn't be a concern, because we would know as women, we would know as mothers, that's a normal. So we just continue breastfeeding because that's a normal. I feel that if we understand and know normal, then we'll understand and know abnormal, and then we'll know what to be concerned about. So let me wrap that and say, Facebook is not always a bad thing. However, you have to be very careful in what you're hearing and the information you're receiving. I'm hoping with this book that it's going to give you a good foundation on what's normal and what's not normal, so that those questions that are out there to Facebook is going to be more, it's going to be an educated question versus a question of fear. So not that it's bad, it's just, where is the information coming from? Is the information truthful? What's my source? This is all really, really important. You also don't want to go to a healthcare provider. You wouldn't want to come to your midwife and say, is she operating off of information she heard somewhere? You would want her to pull out her studies and say, this is standard of care, and this is the reason why it's standard of care, and this is what we see. These are the studies. You would want her to be well-educated and well-founded and understand that certain studies are bought by certain studies and able to interpret all of that information. And as mothers, we almost have to do that for ourselves. We have to interpret the good information from the bad, and we have to work off of that. So, with all of that said, the doctor then makes a note in his book, if my ideas don't work for you, don't force them. This is not an end-all be-all. This is not 100% correct always. It doesn't apply to everybody. Some of these things work and some of these things don't. It says back off and use the principles presented here to guide you to another therapy. So in other words, this is a guide. This is not anything other. And I will tell you, in working with women and in general with the practice of medicine, right, that not everybody is going to respond in the same way. Whenever you give an herb, one person will respond different than the other person. And they use the word practicing medicine because sometimes it is just practice. Like, what works for 3 people doesn't work for the last person or the 4th person. It's going to be different for everybody. But we have a standard of what normally works, and then we take that standard and we apply it to everybody. So this is a guideline. Here's what should look normal. And again, we're looking at abnormal versus normal and normal versus abnormal. This is going to be hopefully a way for you to say, this is what my child normally looks like. And now here's something that's presented that's not normal. And what do I do with it? So, all right. So further in the text, in the introduction here, it states, I read more than 150 articles on the subject in various medical journals. Not one of these articles was able to show that regular exams by a doctor gave a child any better chance of good health than he would have if the exams were not performed. The only benefit shown was that the information transmitted from the physician to the parent then enabled her to recognize the symptoms of disease sooner than she would have otherwise. So, physical exams is very first part talks about physical exams in the book. And it talks about taking the child to the doctor. And the only benefit that he saw from his clients coming in and seeing him was that he was able to relay the information of what he found in the physical. And hopefully catch a disease process sooner than later. But how long? And then he states, well, child exams took approximately 7 minutes, which is about average. And then obviously the doctor-parent education is just a mere piece of that directly after. So parents are not really getting the education that they need in the 7 minutes. Again, the book is designed to give you that information so that when you do walk in to your pediatrician with the understanding you're going to see him for 7 minutes, you can get the information you need. Parents know their child better than anyone else. Is that not true? And their observations are invaluable. When bringing a child to a doctor for medical treatment, 90% of the information used to make a diagnosis comes from what you tell the doctor about your child's symptoms and the child's history. The physical exam provides the other 5%, and then labs provide the final 5%. Nevertheless, parents often feel or are made to feel that they cannot adequately judge when something is wrong with their child. Perhaps more important, they are often told that they are incapable of evaluating the seriousness of any given illness or condition. As a result, parents tend to run to the doctor at the first sign of a problem. Isn't that very true? We second guess ourselves, and then we say we need this validation. And a lot of times that validation doesn't even come. And it's the doctor that's receiving the validation. Oh, thank God for Dr. So-and-so, otherwise I never would have known. But really in that deep-seated part of your heart, you knew something wasn't right. And how much did the doctor really give insight other than they can say, oh, make you feel better. You made the right decision to come in. Or, oh, make you feel bad, make you feel incompetent. I think the American system sometimes is not always the best. And sometimes we have doctors that are not providing the education. Or they're, when they do provide the education, it's done in a way that is putting the parent down. You need to seek out people who are going to boost you up and support your decisions. Excuse me. They're going to support you and encourage you. Like, good job, Mom. That's one of the things I try to do when I counsel with breastfeeding is, you're such a good mother. You were so, forgive me, so sorry. You were so in tune with your baby. You knew exactly what your baby needed. Or, sometimes moms just need that encouragement that they were on the right path and their instincts were correct. And I think we lack that sometimes in our medical model. So, when cultures or x-rays or blood tests or other tests are used, they often serve only to confirm what the doctor already knows, rather than to provide them with new information. Add this to the fact that approximately 90% of childhood ailments will cure themselves. Did you hear that? 90% of childhood ailments cure themselves. That's pretty fantastic. So, what we hope to illustrate in this book is how to recognize when your child's condition merits a trip to the pediatrician and whether it may not. That is the whole purpose of this book. According to a study, if your child has an ailment that truly requires medical attention, that child only has 50% chance of benefiting from the treatment. Consider, too, that should your child be taken to the doctor for one of these conditions, it is inherently self-correcting. You may be needlessly subjecting that child to tests, procedures, or drugs that could ultimately prove more harmful than the condition they were intended to help. 90% of this study, so there's an American Medical Association study of 60,000 people in North Carolina who saw a doctor about a specific illness or complaint. 90% of those children got better without treatment. 10% may have benefited from the doctor and the treatment, and then 5% of them actually did benefit. The remaining 5% actually got worse. So you have this 50% chance of actually benefiting from a treatment. 90% that are cured naturally. If you just leave it alone, it goes away and it's taken care of. Or if you use natural methods of treatment, for example, like ringworm, you'd use a natural treatment. And then it goes away, it's treated. Or you take the child into the doctor and the child's given an antibiotic. I have actually heard of that happening. And if you know anything about ringworm is fungal. It's not bacterial. So an antibiotic actually does not treat. You would want to use an antifungal treatment. So that has a 50% chance, right? Like you could get the doctor that gives you an antifungal, or you can get the doctor that gives you an antibacterial, and the antibacterial does nothing and the ringworm gets worse. And that's a perfect example of a common ailment that could have been treated at home, that would have been easily remedied at home, that could have been made worse or could have been made better. So, not telling you not to take your child to the doctor, but, and at some point every child needs a physical exam. But we are questioning the medical science and how capable they are of performing treatments that are helpful. So, that in a nutshell is what this book is all about. Now, according to Wu Tan's theory here, he states 3 things. This is really interesting. He states that there is a continuum of wellness, and it lies between sickness and wellness. But in between, there's a third condition. It falls smack dab in the middle, called unsickness. So the difference between sick and well is pretty self-explanatory, but the difference between wellness and unsickness is not necessarily clear. So when your body is able to resist disease, when you are unsick, this capability is diminished. So you have where you're feeling well and your body is able to fight off a disease, no problem. Then you have sick, where you come down with a pathogen, your body is currently fighting off disease. The unsick is the diminished capability of your body to fight off an infection. Let me give you an example. Okay. So you have a bacterial infection, you got a respiratory infection, you're coughing, right? You are not feeling well. You are fighting off a bacteria. Because then your body is what we call immunocompromised, which is where your body is at that time fighting something off. You could get fluid in your lungs that doesn't come up. You may have just a respiratory infection, which means it's not necessarily a bacteria, but it could have been an allergen that caused your upper respiratory. So you breathed in some pollen, your body responded to it, started creating all these this mucus to try and remove that allergen. And because the mucus sat there so long, it's a warm, dark place, bacteria started to develop, and now we're sick. That is, and then you start to get over that, you come in contact with somebody who has strep throat, and because your body has already been fighting it off, and your immune system is lowered, you are what we call unsick. You have come in contact with strep throat, and now you get sick again. You get sick again because your body has not fully regained back to wellness. Unsickness can also come from eating a poor diet. So your body is constantly ridden. Its immune system is not capable of fighting things off because it's suppressed by the things you're eating. Or you take an antibiotic that trashes your immune system. These are examples of what they would be considered unsick. A person goes to the grocery store, leaves a bag of groceries, but an unsick person goes to the grocery store and leaves with a bag of groceries and a virus. Courtesy of the guy who was coughing all over him. If, in trying to maintain a state of wellness in your child, one thing you should understand is that your medical doctor is an expert at taking people from sickness to unsickness, but he's not a professional who's going to tell you how to take your child from unsickness to wellness. This is critical to understand. Doctors, antibiotics destroy bacteria. They help get the child to a point where the sickness is gone, but they don't take the child from an unsick point to a well point. That is our job as parents. And many times these drugs that are prescribed just take care of the manifestation of disease. They don't cure the disease. Okay, so they get rid of symptoms. For example, you have a runny cough, a runny nose cough. You get Dimettab or you get Robitussin, and it helps you take care of that so you're comfortable. It masks the symptom. It doesn't take the symptom away. You have a fever. You take a fever reducer. You take Tylenol. It may break the fever, but it doesn't get rid of the bacteria that causes the fever. So then your child either gets sick with a fever again, they vomit, or they have diarrhea because the body has to get rid of that bacteria or that viral one way or another. And if it can't burn it out, it's going to figure another way out to try and get rid of it. And if you take your body's ability to fight infection away, like breaking a fever, then you're going to need an antibiotic because you've already taken away your body's number one weapon away to try and kill what it's trying to kill. And then you trash the immune system. We have an unsick person, if that makes sense. Or you have a person that's fought off a bacteria that's unsick. So this concept's kind of really important in understanding how to even start with fighting disease in your family or fighting illness in your family. It is true you may not have a medical education, but you have two advantages over any doctor that you walk into. The first one is that you know your child better than any other doctor on this planet. You know your child better than anybody. And the problem that your child has is one that you get to learn about. Your doctor can't possibly know everything about all disease. It's true, guys. When doctors go into medical school, they're taught how to recognize disease and conditions. They are taught on the most common ones. So the ones that are really not common that you've never really heard of, like we have no idea about those. And sometimes you just don't know why certain things are contracted. So just like with women, you know, I don't always know why one person does one thing and another person does another, but you're the parents. You get to see what the child's doing, how the child's responding. That's one thing your doctor does not see. I've heard some people say, oh, my kid was sick at home. They got there and they seemed fine. And then we got back home and it got late and the child's exhibiting symptoms again, which the baby may have been, or the child may have been perfectly fine during the day. And that's what your doctor saw was perfectly fine. It happens. So, even with common illnesses, no doctor can personally keep up with every bit of new research or information that becomes available. And if you're trying to understand an illness that your child has, you have the time and the ability to narrow your focus and take the time to learn as much as possible about that particular illness. And you are going to be your child's best advocate. Your doctor sees how many people in a day? What, 35 to 50 people a day? And he gives each person 7 minutes of that time. He's not going to know everything about what you're bringing in. You're going to be your own best advocate in this. And searching out what is normal, what's not normal, is something that is important to do as a parent. Where you get that information is very, very critical to the health and well-being of your child. For lack of not wanting to bring this up, but should just bring it up, hot topics are things that you have to really do your research on and be well read and well versed, because they are what's considered commonplace in our community. So one of the first things that we get slapped with is having a newborn come home, are those newborn procedures that are done directly after birth. Vitamin K, eye ointment, vaccines. These are things that in pregnancy, women should be reading about and have a decision prior to the baby being born. And these should be conversations with the OBGYN. And if you haven't found a pediatrician yet, getting a pediatrician and like really doing your research on who you want and doing an interview with that person, making sure that your team who's going to take care of your child is going to be on the same page as you are. Breastfeeding, these are things that you should like be taking a breastfeeding class, getting in connection with women who have breastfed, taking the opportunity to talk to the midwife, talk to the doctors, and get some real good information. So when you come across things that become challenges, that you're able to handle them. And guys, breastfeeding challenges come up all the time throughout the entirety of the breastfeeding relationship. It's not like once you get to 6 weeks, everything's said and done, because babies do teeth and babies do go on nursing strikes and babies, go through lots of different changes that are going to be things that interrupt that relationship. So breastfeeding is a big one. Immunizations are huge. Circumcision, that's all huge. You really need to start researching these things. How to take care of a child with basic illness, like a bacterial infection, a respiratory infection. These are things that, like, you should have an arsenal on hand and know exactly how you're going to treat it. And when it steps outside the norm, have a pediatrician to go to that you can consult with. And it's really what it should be, is you walking into their office and consulting with them. So I'm picking up where I left off, and I wanted to end with this in the introduction. It states that whether you're dealing with a common problem or an unusual one, a chronic condition or a one-time disease, remember to keep your mind open and to hold on to your common sense. Be willing to consider ideas and treatments that are outside the realm of the current medical wisdom and to question standard practices. After all, modern medicine is constantly changing, and so today's new radical idea may be tomorrow's accepted treatment, and vice versa. Sometimes, Gardasil is a perfect example. Give Gardasil, but then we have all these issues related to Gardasil. Healthcare providers are constantly learning. That's why we have what's called continuing education units, CEUs. We're constantly learning from the people that we encounter, the diseases or the sickness that we encounter, and then also from our own child's experiences. So just like you may be learning all about this, maybe a whole new world, your healthcare provider never stops learning either. Continue to learn about healthcare by reading other sources, attending seminars or lectures. Stay open to new ideas. Every step you take toward becoming an educated consumer of medical care and a practitioner of preventative medicine helps to ensure the continued health of your family. And when you come right down to it, that's something only you and not your doctor can do. So that is the end of the introduction. Very well said introduction. I want to start with the first chapter. It talks about the body as a whole. They start off with, the purpose of the doctor's physical exam is to diagnose specific diseases. Your intention to perform the exam will be 3 things. 1, recognize and evaluate what is normal for your child. Notice where there is a deviation from the norm, which means notice when it's abnormal. And 3, to judge when an illness requires a doctor's attention. These are the 3 things that you want to do. Now, it's going to go on. It talks about a little bit about doing a physical exam on a regular basis so that you know what is normal for your child. And by learning and recognizing the evaluated deviations from the norm, or in other words, the abnormal, you will know when it is appropriate to seek the doctor's services. So, you do a physical exam, you get to an idea of what's normal. Now your child has something going on. You do a physical exam, and you can tell just by that whether or not you're going to need a doctor's care. So, for example, say one day you're doing an exam over your child, you discover a lump in the abdomen, and because you performed physical exams prior on your child regularly, you know that the lump is not normally there. In order to find out its cause, you will need to consult with a doctor. Who has the opportunity to palpate thousands of bellies. So many doctors have, part of our physical routine when you come in is to palpate a belly. So we've had the opportunity to feel lots and know what's normal and what's not in comparison to a population of people versus just one person. So learn to recognize and evaluate problems. He goes on to say, I deal less with treatment than with recognizing problems. And for good reason. There are many approaches to any ailment, and medical doctors provide only one. There are so many other healthcare providers out there: chiropractors, osteopaths, homeopaths, naturopaths, nutritional therapists, and other certain degrees of success in treating various diseases and conditions. No single field in the health services, and this is true of obstetrics too, has a perfect batting average. So in other words, you might go see your pediatrician, but they are not the one and only person who you really should be seeing. You should be seeing a chiropractor. If you don't know about diet, nutrition, and how to have a healthy lifestyle, you should be discussing or talking with a nutritionist. And finding a good nutritionist is super important. This is not the My Plate or the food pyramid. This is talking about good, healthy nutrition. You can look at documentaries. Netflix is full of documentaries. If you want to talk on any hot topic, you want information, you can find it. There are documentaries on, like I talked in my video prior about circumcision and vaccinations and all kinds of different things. So if you're looking for information on newborn procedures, that information's out there. If you need help finding it, contact your healthcare provider. Contact me if you want, and I can help you find that information. You need to have good informed decision making. You need to have good informed consent. Before you sign anything, before you agree to any procedure or treatment, you should be looking at the inside of those medications that, if the doctor says, I'm going to give you an antibiotic, what's the side effects? What's the risk? What's the benefit? Can this be treated without an antibiotic? Will it go away without medication? These are good questions to have. And take charge of your child's health, and it's also going to help cut medical costs. So for those of you who have to pay for insurance, those of you who are self-pay, you're having to pay for this stuff. So knowing when to use an alternative treatment or a natural treatment is important, because you may have to pay $150 for that medication, but you could use something that works even better, say for yeast infection, like, I've got to go spend $15 to get Monistat, or you can use gentian violet, or you can use garlic, or you can use some other method that's going to help take care of that problem. Now, like we had mentioned before in that earlier in the video, that you need to look at the condition that's causing that problem. So for example, with the yeast, if you don't take care of your diet, or you don't take care of the condition that's causing the yeast is just going to come right back, and you can treat it all day long. It's just going to continue to come back. So it's about taking you from that place of unsickness to wellness. All right, it goes on to say, in fact, research supports the notion that patient education can reduce medical costs. A study reported in the Journal of American Medical Association showed that every dollar spent on education intervention between $2.50 and $3.50 is saved utilizing medical services. So you need to be informed. You need to be well educated about these things. What happened in days, and years ago, we had a village mentality where we had people that were being educated by the people in their village or their surrounding area. Education was always constantly something that people were offering as healthcare providers, or a naturopath. The modern medication or modern medicine is not set up that way. They're set up to have a hierarchy, so a doctor is over, not necessarily so that you can be educated. You should never ever. One of the things that irritate me more than anything is, whatever the doctor says, he's human. And do you really want to leave that responsibility up to one person that may not have all the answers or the education? And not to say that they don't, because they are very, very well educated, but people make mistakes too. So in some instances, these same parents sought a doctor's advice much sooner than they would have otherwise, because they were able to identify abnormalities that would have gone undetected had they not performed an exam. So they're talking in general, people who have done exams have actually sought the advice of a doctor sooner than they would have otherwise, because they were familiar with what their child's body looked and sounded like. So not only do we see a reduction in health costs, we also see that these parents who do need to seek a doctor's treatment are getting in there sooner than what they should, or from what they would have. So it should only take 10 to 15 minutes to do an exam. And you set that time aside for an opportunity for a teaching moment with your child. You can use it to discuss personal hygiene, sexuality, nutrition, menstruation, whatever's on your child's mind. And most children, according to him, he said that he's found children come to view the exam as an expression of the parents' love and value it as such. So, next video, we're going to actually dive into how to do a physical exam, and I'm going to use my daughter, and I'm going to show you how to do a physical exam on my child, and hopefully that's going to help you identify the landmarks on your child. Every child is different, and as they get older, I may ask my older children too. Of course they grow, and so landmarks change a little bit. Not a whole lot, but I will do one on my younger and then one on my older. So how often do we examine or do a physical exam? In order for a physical exam to be useful, you must perform it regularly when your child is healthy. Not when they're sick, when they're healthy. And if you don't, the information in the chapters will do little good, because you have to have a good reference for your child before the child is ill. When you're first learning to do an exam, you should perform it about once a week. As you become more proficient, you can gradually stretch it out, time out between exams to about once a month. And then after you get that under your belt, about every 3 months, and then every 6 months. Once you really get that under control, the book is suggesting you can even go up to a full year for a well visit. You will, of course, also want to examine your child anytime that the child is sick, and to better understand the symptoms and be able to judge the severity of the illness, you may need to consult a doctor. And this is where having that established care comes in. I'm going to be honest. We've been up here for over a year. My children, I do regular health exams on as needed, and I have not yet had a reason to go to the pediatrician. I'm not endorsing that. I really probably should establish care somewhere. I haven't up here in Pennsylvania, but establishing care and having your child in at least once a year is important. So if something were to happen to my child, and if I didn't have established care with somebody, my only alternative to have anything evaluated would be to go to a hospital. Nobody wants to sit for hours on end to go into a hospital to have an ER doc who has a very limited knowledge on pediatrics come in and look at your child. Hospitals are great for emergencies. They're not there to give you the ability to have access to somebody for the flu. And it happens. People are like very nervous about what's happening with their child. My child has 102 fever. I should take them to the ER. And what happens? The ER doc, who's not, specifically trained in pediatrics, looks at the child and says, "Yep, it's a fever. Give them lots of fluid. Here's an antibiotic. See you later." But if we understood what normal was for our child, maybe we could, save that money or save that time and not drag our child who's sick into an ER to make everybody else sick, or to, subject them to that. And it's difficult as a child to be drugged into an ER. Now, please don't misunderstand me. If your symptoms warrant needing to go to an ER, go to an ER. But over a weekend, it seems like the ER gets used as a physician's office because people have no other alternative. If you're given the knowledge and education to know when you need to see a doctor and when you don't, that's helpful. Establishing care with a physician is super important so that those things don't happen. I recommend that you first do, so as you're doing a physical exam, the recommendation is that you first do all the sections that require the child to be in a sitting position, and then complete all the parts of the exam that require the child to be laying down. And so to do it in that order. So the other thing, and this is interesting. Okay, so it states, study the information you have, consider the possibilities, and look for the most minimal possible problems. So like if your child is sick, you're doing an exam and you find something that seems to be a little unnerving, automatically assume the least, not the worst. And then if your exam leads you to believe that you're dealing with something other than a common easy treatment, consult the doctor. So trying to think of when this could come in. I mean, I think people automatically race to the worst case scenario. And I'll be honest, I am the first thing that pops in my head when anything presents itself is I go immediately to that worst case scenario and then I back myself up. Okay, you know, I don't know if I do that because that's the way I was taught, but that is where I go. Like, well, this could do this and this, that. So when you see something that seems alarming, for example, fever is a good one. My child's running a fever. Well, what's normal for a fever? If it's 105, yeah, that needs to be evaluated. 105 is a terribly high fever. Let me make that real like clear. 105.0, not 100.5. It's 105. 105.0. That's a high fever. If your child is running a fever 102.3, let's say, that may not be worthy of running off to the doctor. That may just be something the baby or the child is fighting off. So automatically think least case scenario with that other scenario in your head behind you. And that's where I'm going to stop for today. We're going to stop. It's pretty much in to the introduction, the first page of the physical exam. And on the next exam, or the next video, we're going to talk about the things you need for a physical exam. I'm going to show you the things you need for the physical exam. We're going to talk about health histories. We're going to talk about general exam signs, so vital signs, body temperature, appearance, and then we're going to actually dive into maybe parts of the skin and what looks normal on the skin. I'm going to show you how to do basic vital signs on your child and what is normal. Oops, and just in time, I have somebody checking in with me. So I hope you guys enjoyed the video. Please leave your feedback and let me know what you think and how you feel about it. I really am loving this book. I know it's lots of information, and you know, I think at some point you might even feel a little bit like the toes are getting stepped on. And not that I want you to feel like your toes are getting stepped on, but I think that education is the most it's the best weapon we got. You know, it's the best way to take care of our kids. And if we are educated and know what's going on, when we walk into that pediatrician, it really doesn't matter how they feel. They may be really happy that they're talking to somebody who knows what's going on with their child. And if you don't have a pediatrician who's going to be supportive, then you need to find a new one, because you really should find a pediatrician that's going to be happy that you're taking an interest in your child. That's important. And they shouldn't be threatened by that. So anyway, well, stay well. Don't be unsick, stay well. And I hope to look forward to hear what you have to say in the next video. Can't wait to show you that physical exam, and hope you guys have a wonderful afternoon. Thanks for listening. Take care. Bye-bye.